going to be assessing her posterior thorax. So can you take a deep breath for me? Okay. Everything rises and falls symmetrically, and her breathing is unlabored, and she appears in no signs of distress. All right, now I'm going to put my hands on your back, Sarah, and I'm going to have you say 99.
99, 99, 99, 99.
Okay, that is assessing for tactile fremitus, and vibrations were felt throughout. Now I'm going to percuss. Okay, and it's resonant, percussion is resonant throughout her lung fields. Now I'm going to put my stethoscope on your back, and when I put my stethoscope on your back, I would like for you to say 99. Okay, all right.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. That is testing for bronchophony, and the sounds were muffled throughout her lung fields. All right, Sarah, now when I put my stethoscope on your back, I'm going to ask you to take a deep breath and let it out. Okay. Her lung sounds are equal bilaterally, and there are no wheezes, rails, rhonchi, or crackles noted. All right, now I'm going to assess you for CVA tenderness. So sit up for me and let me know if there's any pain. Any pain?
No.
Okay, very good. All right, now I'm going to move to the front, and I'm going to do her anterior thorax. So I need for you to sit up for me, Sarah. When I put my hands on your chest, I want you to say 99.
99, 99, 99.
Okay, vibrations are felt throughout. Now I'm going to use my stethoscope, and I'm going to have you say 99 when you feel my stethoscope touch you.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, very good. The sounds were muffled throughout her lung fields. Sit up for me. I'm gonna listen to you. I need you to take a deep breath and let it out when I put my stethoscope on you. Okay. Her breath sounds are equal bilaterally, and there are no adventitious sounds noted. All right, now I'm going to listen to your heart. First, I'm going to listen to the bell. In the first place I'm going to listen to her heart is at the second intercostal space, right sternal border, and that is over the aortic area. All right, now I'm moving to the pulmonic area. That's the second intercostal space, left sternal border. Now I'm moving to the third intercostal space, which is left sternal border, that's Erb's point. Now I'm moving to the fourth intercostal space. Sit up a little bit more, thank you. Fourth intercostal space, left sternal border, and that is the tricuspid area. Then I'm moving to the fifth intercostal space, mid-clavicular, and that is the point of maximum impulse, or the mitral area, okay? Now I'm gonna turn my stethoscope over, and I'm gonna listen with the bell of my stethoscope over these same areas. So this is the aortic, the pulmonic, Erb's point, the tricuspid area, and the mitral area for the point of maximum impulse. Okay, S1 and S2 sounds were noted on auscultation. There were no S3 or S4 sounds present, and there were no murmurs or breathes. All right, Sarah, now I'm going to get you to just sit up straight for me for a second. And I'm going to feel the point of maximum impulse, and it's not displaced. No enlargement. I'm going to have you lay down. And we are gonna do, you wanna put your shirt back on? Sorry, you wanna put your shirt back on? No, not yet. I'm sorry. I'll let you put it on in a minute. I'm doing the abdominal assessment. So first I'm inspecting her abdomen. The color is appropriate for ethnicity. Her abdomen is flat. There's no signs of distension. Her umbilicus is midline, and there are no signs of herniation. There's no scarring or lesions on her abdomen. Okay, so I'm going to start by auscultating the 4 quadrants of her abdomen for bowel sounds. Okay. Bowel sounds are present in all 4 quadrants, and they are hypoactive. All right. Now I'm going to assess her abdomen. I'm going to percuss her abdomen. Okay, tympany is present throughout all 4 quadrants. And then now I'm going to lightly palpate your abdomen. Let me know if you feel any tenderness. Any tenderness? Okay, now I'm going to deeply palpate your abdomen. Any tenderness? Okay, now I'm going to palpate your abdomen. I'm going to palpate your right upper quadrant for your liver, for the border of your liver. So can you take a deep breath in for me? Okay, can you let it out? Okay. All right, now I'm going to be palpating your left upper quadrant for your spleen. So can you take a deep breath for me? Can you let it out? Okay, her spleen is not palpable. Now I'm going to palpate for her left kidney. All right, I'm going to palpate her right kidney. Okay, very good. And her kidneys are not palpable. All right, now I'm going to do a special abdominal test, and it's for the Rovsing sign. And this is when I'm going to deeply palpate her left lower quadrant, and she's going to tell me if she feels any pain in her right lower quadrant. All right. So I'm going to palpate. You feel anything in your... Okay, so she's negative for appendicitis. Okay, Sarah, now you can sit up and...
On to the next body system. I think what I want to do next is just your chest area here and your back, okay? So I may actually set this butt up a little bit so we can do a little bit better of an exam here. Go ahead and lie back for me. All right, so I'm gonna move these necklaces out of the way, okay? So looking at the chest area right here, we can see that it's flat, it's even, it looks symmetrical. I'm not noticing any obvious redness, swelling. You know, everything feels normal. We're just going to palpate real quickly. I'm going to feel for the apical rub, so that's in the left 5th intercostal space in the midclavicular line, which is right here. And I can feel the apical pulse, which is a normal exam. I'm also going to go ahead and take a listen to her heart sounds and make sure that everything there sounds normal as well. We're going to listen with the the diaphragm and the bell of the stethoscope. All right, so we start off by listening to the aortic area, which is the 2nd right intercostal space. And then we do the pulmonic, which is on the left 2nd intercostal space. Erb's point, which is the 3rd intercostal space. The tricuspid area is the 4th intercostal space. And the mitral area is in the 5th intercostal space, midclavicular line. All right, everything sounds good. I'm just going to check again using the bell, okay? So again, aortic, pulmonic, Erb's point, tricuspid, and mitral. So I am hearing a normal S1, S2 sound. There's no murmurs, clicks, or gallops, so that's a normal heart sound that we're hearing there. What I want to do next is take a listen to your lungs on the anterior side of the body as well. So that's the front side, okay? So we start at the apex of the lung for this. We use the diaphragm of the skull for of the stethoscope for this exam. And we're gonna go right up here. And I'm just gonna have you take some deep breaths in and out, okay? And we always listen side to side to compare. Moving down. And we're also going to listen to the lateral lobes. All right, perfect. So what I'm hearing are normal breath sounds. We have bronchial sounds up here, which are the highest pitched. In the middle, we have bronchial vestibular sounds, which are medium pitched. And down here, we have vestibular sounds, which are the lowest pitched. And that's a normal breath assessment on the front side. We're going to go ahead, I'm going to listen to the back side now. Okay, so I'm going to put this back down. All right, I'm going to move your hair out to the side here because we're going to do a couple other things as we're listening to the lungs back here. I am going to go ahead and just inspect the back for symmetry. Everything looks symmetrical. I'm not seeing any redness, swelling, lesions, scars, anything like that. I'm just going to feel down your spine. And the spine does feel midline, and it also feels normal. Is there any tenderness there? And then right before we get started listening to the lungs, there is one other exam that's just easy to do right now, and it's just checking for CVA tenderness. So I'm just gonna give a little bang on on the back of your back here, both sides, and you tell me if you feel any tenderness, okay? Any tenderness with that? Good. So again, just gonna listen to the lungs back here. I will have you just take some slow, deep breaths for me, okay? And we're gonna use the diaphragm for this as well. Okay, deep breath. And we're gonna listen laterally as well. So on the front and back for the lung assessment, I'm not hearing any abnormal breath sounds. There's no wheezing, bronchi, crackles. We're definitely hearing the inhale and exhale, which is what we want to hear without the additional sounds in there. I am going to do another test back here. It's called tactile fremitus, and it's just to feel for a vibration. So we should feel the vibration stronger up here, and it should get diminished as we go down here. As I move my hand across your back, you're just going to say the word 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. So we are noticing that, yes, that vibration is stronger up here and it diminishes as we move down the back, which is great. One other exam I want to do is just going to measure, making sure that it's symmetrical when you breathe in and out. I'm going to place my hands down here and I'll have take a nice deep breath in, okay? Again, one more time. Okay, and I am noticing that my thumbs are rising symmetrically as she's breathing in and out, so that's a normal exam. All right, so next thing I'm going to do is kind of another full body assessment here. We're going to look at your neck, and I want to take a look for any jugular vein distension, which I'm not noticing. I am going to palpate your carotid arteries right now, okay, each side. All right, and I'm going to come over here. Perfect. So they're both bilaterally equal, both sides about a +2, which is a normal finding. And the next thing I'm going to do is I'm just going to have you hold your arms out for me. I'm going to feel your brachial pulses and the radial pulses. We're also going to do posterior tibular pulses down here. And if you don't mind, I'm going to remove these shoes because we are going to do your dorsal pedis as well, which is right up here. All right, bilateral, equal both sides all the way down, so that's great. I'm going to have you lie back so we can do an abdominal exam next, okay? I'm just going to pull this out. Feet right here. All right, so I'm just going to take a look at your abdomen first, okay? We're going to take a peek at everything. Everything looks symmetrical. I'm not noticing any redness, swelling. There's no obvious masses, anything like that. Her stomach is nice and flat, normal pigmentation throughout. And then the first thing I'm also going to do is just take a quick listen with the stethoscope again. We're looking for active bowel sounds in all 4 quadrants. So, just going to take a quick listen. right, and so there are active vowel sounds in all 4 quadrants, which is a normal finding. Next thing I'm going to do is just a light palpation, okay? I'm going to palpate every quadrant, and you just let me know if you feel any tenderness at all, okay? Any tenderness there? Good. Good. All right, I didn't feel anything abnormal, and you did not, I didn't notice any guarding. She's not retracting in any way, so that's a normal exam. All right, so I'm gonna do a little bit of percussion too, just to make sure that none of your internal organs are abnormally swollen, okay? So just a little bit of a percussion. Again, not feeling any enlarged liver or spleen, which is wonderful. While I have you lying,
first I'm going to ask you actually to say, just let me feel for some thrills and heaves. Okay, just normal breathing. Okay, now I'm going to listen to some of your, with the bell of the stethoscope, I would be listening to the temporal and the carotid. And then I'm just going to listen to the apical. Okay, now I'm going to listen to your heart. This would be the aortic, pulmonic, tricuspid. I would have to just go in and listen, Bree.
Okay.
Good? Mitral and apical. Good, very good. Heart sounds good. Now I'm just gonna check for some swelling in your extremities. If I could just take a look at your arms. Okay, looks good. Just, if you could just dangle your legs. I'm just going to feel for any kind of swelling, look for swelling, any edema, any pitting, which would indicate swelling. And it looks good. And now I'm going to feel for your pulses, okay?
Mm-hmm.
First I'm going to feel for carotid. Just keep your head still. Okay. Okay. And now the brachial. Side. Okay, and then the radial. Okay. And then I'm going to ask you to lay down so I can feel for the femoral. Okay. Okay, and then on this side. Okay, and then popliteal. Okay. Okay. And then on this leg. Okay. And then. And now I'm going to move into checking your lungs. So I'm going to ask you to sit up for me. I'm just going to take a look at your chest and your back. And then I'm going to ask you to raise your arms for me so I can look on the sides. Very good. Good. And then now I'm going to ask you to say 99 again, because I'm just feeling for the vibrations.
99, 99, 99, 99, 99, 99.
Good. And now I'm going to listen. Just breathe normal. Okay, if you could raise your arms for me, just so I can listen. Okay, and on the other side. Okay. So listen here. You can put your arms on, yes, sorry. Okay, good. I'm just going to ask you to also, one more time, I'm just checking for vibrations again. If you could just say 99.
99, 99, 99, 99, 99, 99.
Good. Now I'm just going to check for kidney tenderness. Let me know if this hurts you.
Mm-mm. No.
Good, very good. Next, I'm going to move into checking your abdomen. Do you have any complaints about anything?
No.
Any issues? Okay, if I could just have you lay down if you don't mind. Okay, I'm just going to have to lift up your shirt to look. And I'm going to listen first. I'm just going to move these a little bit. Okay. Now I'm going to feel for the liver and the spleen, okay? I'm going to start by percussing, so I'm going to start from down here.
Mm-hmm.
And percuss for your liver. Okay. And then from here. And when you feel for dullness, that's when you've located the liver. Now I'm going to palpate for the liver. I'm going to feel for the liver. This might be a little uncomfortable. I'm going to ask you to take a deep breath, and I'm going to push down and feel for the liver. Okay? On the count of 3. 1, 2, 3. Good. And now I'm going to check for the spleen. Same thing. I'm going to ask you to just give me a chance to feel for that, okay?
Mm-hmm.
Okay? Good. Now I'm just going to also palpate in the rest of your abdomen, okay? I'm going to start off light, go a little deeper, and then a little deeper, okay? A little deeper. little deeper. Is that hurting you?
No.
Good. Okay, good. Now I'm going to check, I'm going to do a test to check for gallbladder tenderness or any kind of uncomfortableness with the gallbladder. I'm just going to push down and you will let me know if it hurts, definitely. Okay, very good. And now I'm going to do a couple of tests to check for appendicitis or any abdominal inflammation and also your hip flexors, okay? So I'm gonna ask you to bend at the hip and bend at the knee and just allow me to move your leg. And if you have any discomfort, just let me know. Okay, good. Put your leg back out. I'm gonna have you just raise your leg a little bit and now do not allow me to push down, resist. Good, very good. So
I'm going to listen to your heart valves right quick using my diaphragm. This is the aortic. Okay. Pulmonic. Tricuspid. That was tricuspid. Now I'm going to listen with the bell of my stethoscope. Okay. No abnormal sounds noted. Alrighty. Now I'm going to look for PMI. No heaves noted. No abnormalities noted there. I'm going to listen to your breath sounds right quick, okay? Just breathe normally. Okay, lungs are clear and equal bilaterally. Now, we are inspecting the abdomen. I don't see any abnormalities, any rashes, any bruising, any swelling, any lumps. I don't see any pulsating going on, any increased peristalsis going on in the abdomen. I'm going to auscultate all 4 quadrants. Okay. All right. Normal active bowel sounds noted in all 4 quadrants. Now I'm going to percuss your abdomen. I'm going to tap on it, okay? Sounds hollow. Alright, sounds hollow in all 4 quadrants. Now I'm going to lightly palpate your abdomen. Tell me if you feel any tenderness at all. Now I'm going to deeply palpate. Do you have any tenderness? No abnormalities noted. Palpating the liver. Feels normal. I'm going to listen to the aorta and the renal arteries. No breaths or abnormalities noted.